couple of things before I start and press record, so that you're very well aware in terms of how to access the recordings of the session at a later stage, so that if you need to go across and revisit them, or discuss, or probably look at them for your purposes of recapping, then they are available through the YouTube channel. So just briefly showing you. So this is what you get to see is the YouTube channel. And obviously what I would suggest at some stage would be all of you to subscribe, click on the subscribe button. And this channel is accessible through YouTube. If you type youtube.com/Versity Online, all one word, and you should be able to see it now. Now, when you're on the channel, what I would suggest in this case would be go in and obviously click on the subscribe button. And the subscribe button would give you access to some of the videos which are only available to subscribers. And if you need to look at specific videos for the specific sessions, they're all labeled accordingly to the sessions which are being done. Like today's session is being broadcast live, so it is showing live here. But as you can see, this is academic and research skills. HSC in short stands for health and social care. Obviously, we have over 10,000 videos on our channel. 2,500 are in the open domain. So obviously, you will need to look for either your course provider, which is ATHE, and then followed by HSC. And then you look at the learning outcome and the specific learning outcome that you're going to be listening into. So some of the previous sessions that I've done on this unit, which is the academic and research skills learning outcome 2, which is available here. Academic, we had 2 sessions or 2 recordings because there was some issue in terms of learners not being able to join, so I had to open the session. So that's why these 2 are the same. And then we have the academic and research skill learning outcome 1. Now, the other bit which I quickly want to refresh and obviously show is that at any given stage when we do the sessions, these sessions are predominantly done on a learning outcome basis. And the learning outcome basis tend to be that depending on the unit, if, for example, this is the unit that we are teaching, and in this unit we have, this is where the learning outcomes are, and then the assessment criteria are the task or the indicative content that we cover in each learning outcome. Now, when we look at learning outcomes, depending on which learning outcome is being delivered and how many are there in a unit, that corresponds to the number of sessions that you are going to attend. So in this particular unit, there are 7 sessions, 6 primarily to cover the learning outcome, and 1 session after the completion of the unit to discuss the assignment brief and how to put together the evidence for this particular unit. Now, we can't just teach you anything. Obviously, this is also given to us by the awarding organization. And most of the sessions that you see and the presentations and the material that you see and that you'll be reading would primarily be essentially, covering learning outcome indicative content, which is given for each learning outcome. So today's session, when we look at covering LO3, is going to be looking at covering this particular bits. And that is where the presentation and our discussion will primarily be based on. So we'll be looking at understanding how to take notes, what is active listening, what is passive listening, what are active listening skills, and then how do we look at taking notes by looking at understanding a few methods of note taking. And this would essentially be discussed in today's session. Now, with a bit of a quick recap, so let me press record, and then a bit of a recap that we would do in terms of understanding what we've covered so far, just for the benefit of, obviously everyone. So in today's session, what we are looking at is, the academic and research skills. Now, this is an important unit, keeping in mind, this unit teaches you how to look at doing academic writing. When we look at doing our assignments, when we look at writing a report, when we look at creating evidence which is submitted as assignments, this unit is basically going to be directly helpful, because this unit teaches you various techniques in terms of how to do academic writing, what are the best ways through which you can start writing assignments, and also gives you an idea in terms of what is Harvard referencing. Now, this unit is also related to the fact that we need to be able to understand what are our strengths and weaknesses, what is our language proficiency specifically in English. And then we need to do a assessment, which is primarily done through a skills audit. And there's a template that I shared in the previous session, and this template is available up on Moodle. And when we look at the skills audit, essentially the idea there and thereabouts is to do a bit of an audit for us to understand, what are our strengths and weaknesses in and around, the aspect of English in particular. And then when we look at English, we also look at setting smart targets in areas that you feel once you do your SWOT analysis, you need, for example, you need to up your skills, you need to build certain skills. Then in those cases, what will tend to happen is that we will look at doing a SWOT analysis first, and the SWOT analysis is going to be, followed by what is called a skills audit, and these two will then inform that, these are my weaknesses, these are my strengths, and essentially what we will do is then know about our English proficiency in terms of, what skills we need to develop. Now, there was also a link which I had shared, and that link which I predominantly shared was primarily for you to be able to go in and do a particular test on English language on the British Council website. And that link was primarily shared so that you could go in and do a particular test, and that would tell you what is your level of English. Now, this is a free test, obviously, but it's a multiple choice question test, which allows you to understand what is your level of English in terms of reading, writing, speaking, and listening. You would need to register on the website, but the test is free. It is multiple choice questions, takes about half an hour to do. And at some stage, once you go through this particular test, what will then happen is you will take a screenshot, and that screenshot that you take will give you the level of English. So in my case, when we did the session, we did this particular, I did that test quite quickly. And obviously it came out that my level of English is B2 upper intermediate, and this is equivalent to IELTS 6.5 to 7.5. So essentially, this is a screenshot that you would need to download, or you can obviously print that page, and when you print that page, this is something which will be directly useful, for you for this particular unit, because what you're looking at doing at some stage would be to correlate your test that you've done here with, the assessment of English language, which is given in the assessment criteria 1.1. And then after we've done this particular test, what we then do is go about and do the SWOT analysis, understand what are our strengths and weaknesses in terms of English in particular. But in addition to English, what I mentioned to you was if you elaborate and write and include, the analysis around things like your IT skills and your organizing skills and your skills on predominantly writing part of it. Now, once this has been done and you've got your SWOT analysis, together with that, what you also end up doing is what is called a skills audit. And this is a template which has been shared. So the skills audit template allows you to understand certain areas, because you can do an assessment on lots of different types of things. But what we want to do is look at this and kind of do this in the remit of this particular unit. We don't want to generically analyze a lot of things. What we want to be able to do is primarily look at doing this on a basis wherein we are looking at in the ballpark of this unit and what the requirements of this unit are. So what I've done is when I've shared this skills audit template, which is up on Moodle, you're looking at basically your organizing of your learning. You're looking at information seeking skills, reading and note taking. You're looking at your writing skills, your spoken communication, and skills on the information technology and working with numbers. So when we look at doing a bit of analysis on ourselves in terms of ranking, when we talk about what is my competency in terms of writing, reading, speaking, listening. So I'm using a scale of 1 to 3. If I think that I have to, I have to have good organizing skills, which is important for my job or important for me in general, then you would rank it, as 1. But if you see that this is something which is not of importance at this stage, then you will probably rank it as 3. But what you're doing is when you're doing this ranking, you're also ranking it in terms of how good your knowledge is on those skills, or how do you see yourself if you have to compare that whether you're a beginner, whether you're an intermediate, or whether you're an advanced user in terms of that skill. So the numbering system will allow you to understand that these are the areas in which I need to look at making improvements. You can't have all twos, you can't have all threes, you can't have all ones. You'll have to have an option wherein when you do your skills audit, you have to be true to yourself. And obviously, in this case, what you need to be able to do is rank them according to a scale of 1 to 3. 1 means you're a beginner, 3 means you're an advanced user or an advanced, and you have understanding on this on an advanced side. And in those cases, you don't need to reskill or let's say do activities to up your skills. And that would mean this skills audit would give you some areas which would allow you to then put in activities into what is called a development plan. And that is what is called a PDP. And this was also shared. There's a template of it on Moodle. And the PDP is primarily for you to be able to understand that after you do your SWOT analysis, when I've done my analysis on strengths and weakness, and after that, when I've done my analysis on strength and weakness, and I know that these are the areas I need to improve, whether it could be academic writing, it could be Harvard referencing, it could be IT skills, it could be related to spoken skills, written skills. And once you have done that, then at that stage, what you would go into and basically do is create what is called a personal development plan. And that PDP personal development plan is a plan that you will develop and using a template which is given here. And this plan essentially allows you to bring in your skills audit and your strengths and weaknesses into this template. And when you look at filling this plan up, what that plan will essentially do at some stage would be to tell you that, okay, these are the objectives I need to fill. This is my priority, which you've got from the skills audit template. What activities you need to undertake so that you can improve those skills or improve your knowledge and improve the, let's say, the remit that you have, either in terms of your job or the course that you're doing. What kind of activities would you undertake and how would these activities help you? You put a target date down, which is to say, when are you going to start this and how you're going to review this, or when are you going to achieve this? And you put a date down there as well. And that would basically become what is called the personal development plan. Now, this was the first learning outcome that we covered in detail. Now, in the second learning outcome, we went about to understand, what is research? How do you conduct research? Why is research required? How it is done? What is primary methods of research? What are secondary methods of research? How do we call research as primary, secondary, or tertiary? And we did a bit of a slideshow to understand the different types of information. When the information is published and is available from an electronic resource or a source, then it tends to be generally second, because you're doing desk-based research, you're able to access it through a website, article, journal, book. If it is reprinted and republished, and then you have a subsequent edition that you're picking up, then it could be a tertiary resource, because it could be a repurposing of primary and secondary sources to represent the information for a current context, and that would become a tertiary source. A primary source would be when you're actively listening in, tuned in this particular session that we are doing on Zoom, and you're receiving the information, that you are a primary recipient of this information. But if you listen to the recording on YouTube at a later stage, then that particular source would become YouTube video, and that source of information will become secondary, because the session would have ended and you're actually looking at the session which was conducted in the past, and then you're watching or viewing that session, and that would become a secondary source. So we did understand why research is important at level 3, why is it important specifically in the case of health and social care context, and why this is important and integrated into this unit. So when you look at patient information records, when you look at previous reports, when you look at previous prescriptions, data which is archived and shared, your medical history, that is where where the research of information and storing of information comes in. Because at some stage when we have to look at obviously, say a GP or your doctor giving you a prescription, looking at what medication has been prescribed to you in the past, are you allergic to any medication? Those kind of bits that are done is predominantly going to be related to getting information which is stored information which has been gathered over the years by nurses, healthcare assistant, doctors, and then they will be used. That information is essentially going to be used to be able to give or provide medication and things like that. So this is where what we need to do is make sure that why you need this research. And obviously that is where the idea was to try and understand that you need to look at understanding how research is done, how research is undertaken, and in what areas when you do the research and you do the research in terms of understanding, they would then be utilized in situations wherein you'd be looking at doing this at any given stage. Now, in the third learning outcome, today we are going to be focused on understanding what is called let's say the tools and techniques which are predominantly required when you are in a part, say attending a meeting, you're attending a training, or in some cases you are looking at, obviously like in this case, you're attending a lecture or you're attending one of the Zoom meetings with me. And in this case, what you're looking at is you're trying to make you will at some stage make some notes, which will be essentially useful for you to recap on the session or recall the session. And that is where, what will happen is we'll be discussing how and when is the process of, note taking required. When do you take notes? How frequently you take notes? How do you go about taking notes? And why is note taking, important? And we've seen this happening a number of times, in different situations. So when you are at home and you're speaking to your kids, you sometimes ask them to take notes. Can you make a note of this? Or when you're going out shopping, you make a note of your shopping list. So these are all situations in which what you're going to do is you're going to be paying attention to help you remember some of the bits which are going to be important that you would want to recall in the future. So taking note forces you to pay attention and helps you focus on a particular job or a particular task which is required to be completed. And that is why, as a human nature, as we look at, we do the process of what is called note-taking. Now, obviously, note-taking then can be done in various ways, and there could be various reasons behind it. It could be because some of you, when I'm teaching, would be taking notes because it helps you concentrate. It helps you recall. If sometimes we write some of the things that you're listening, it helps you remember them quite well. And in those cases, it also helps you concentrate. Taking notes can also sometimes deepen your understanding, because when you take notes, you might then be you might be tempted to understand, okay, hang on, I've written this down, but what does this mean? So basically it initiates the process of questioning, and that allows you to deepen your understanding when you're looking at taking notes. Now, notes taking is also important because sometimes when you take notes and you're going to write them in your own words, paraphrase them, at some stage you might want to cite them in your work. And obviously that would then be also important, because it also helps remove similarity or plagiarism, because I'm explaining certain things and I'm explaining them in my own language. But if you have to replicate and do that in the assignment, or use some parts of the extracts of the lecture in your assignment, then in those cases it will be important for you to primarily look at taking your own notes. And these notes would essentially mean that you're writing the things which are being discussed, spoken about in your own words, and that in the long run or effectively would help reduce similarity or plagiarism. Now, there could be, as I mentioned, a number of reasons why you would want to take notes. If somebody wants to participate, please unmute your microphone, and obviously you can share points in terms of why do you think you take notes at certain situations, in certain times, or when you're attending in certain situations, maybe a training or a seminar. Any ideas why do you want to take notes? Why do you end up taking notes sometimes when you are attending a training, a seminar, a lecture, or when you are at a particular place and you are taking notes, if you're asking for directions from somebody, that how do I go about to this place? If somebody is going to give you some idea that, okay, you take this road and go straight and then turn left, in some stages you won't remember everything. So what you would do is, okay, hang on, let me just quickly write down a few bits, and you would take notes. Any other situations where you would be essentially required to, take notes? Anybody, any examples? So generally speaking, there are lots of situations. So you could look at taking a note in a meeting. If you've been called by your boss and obviously there's a meeting happening with colleagues, and if you're making certain points or somebody makes an important point, you jot that down because that is something which is important, and you'll be using that bit of information and processing it later to include it in the minutes of the meeting. So sometimes it is a case wherein you're looking at taking certain important points down, and they would be some of the important points that you would reproduce maybe in your presentation, in your report, in your write-up, and that would be another reason of why you would want to take notes. The other bit would be to look at prioritizing information. So sometimes when you take notes, you also write down a couple of things, but later on you reorder them to understand, okay, this is the priority and this is the reason why, I would need to do this task first, and then go on and do some of the others. You take notes because you want to be attentive. You take notes because you want to concentrate. You take notes because you want to essentially look at remembering something in the future, which could be important for you, or something that those are bits that you would want to write down. And in those cases, they are things that you would need to recall in the future, reuse in the future. And that is why you end up taking notes. Now, one of the reasons why sometimes when we look at sitting in the class or in a lecture or in a training or in a meeting and we are taking notes, is also to look at that it is showing that you are attentively listening in or tuning into the discussion which is happening in that meeting or in that session. So when I say they, I mean the process through which you take notes also helps you to do your job better. Because at the end of the day, what you can do is easily refer to those important points which have been discussed in the meeting or in the session, and that would help you summarize some of these points when you need to use them in the future at in an easier way. And that is why note taking tends to be important. Now, after this journal bit of understanding, what we want to also do is look at some of the formal reasons through which note taking is done. So when we talk about some of the important reasons of why note taking is done, it is done because you are a part and parcel of a meeting, a conference, a seminar, or a training setup. And in this case, reading and listening, involves taking notes, because sometimes you tend to forget, things. So what, as a human nature, is what we do is we take notes. We make our own notes. How you make it, what you note down is down to a person individually. But generally speaking, when you are in a process of reading and listening, and when you're having conversation with colleagues, friends, peers, your superiors, you would be, if there are things which are being discussed, not at a gossip, but for example, if it's a formal meeting which is happening and you are participating in that meeting, and there is a bit of discussion which happens, a fair bit of discussion which happens, then in those cases, you're doing the process of reading and listening both. If there is something being projected on the screen, like in this case, the slide on a projector, then in those cases, you would be taking notes, which will mean that you're concentrating on the important aspects of what is being discussed. And that could be one strong reason of why we take notes. The other reason tends to be you make notes because you want to recollect some bits of information, but you want to write it down in your own words so that you are able to recollect them easily. And that typically tends to be also the reason why you take notes. Now, also talking about, then when we take notes, in terms of looking at making, say, for example, writing down that information by either visually making something, which could be, say, for example, an image or a graph or a photograph. Sometimes you also write down some bits and pieces of information, but concisely write it down in a few words. And then in some cases, what you also do is you basically draw up a flow chart or some sort of a diagram, which helps you remember that, okay, this comes first, then followed by this point, then this action, then this point. So there are different ways in which you would primarily be looking at the process of remembering things, and that would be through the process of what is called note-taking. Now, note-taking can be a passive process. Note-taking can be an active process. Now, when we talk about active process, what we are looking at is that when note taking is done, it also enhances your listening because you are attentive and you are essentially writing down the important points which are being spoken. And in this case, because you're listening actively and you're listening to the source directly, this process is called active note taking. Because in this case, you're hearing it firsthand and you're totally concentrated and focused on what is being discussed. And then you're immediately taking notes in a very systematic approach. And that would essentially be the process of what is called note taking. Now, active listening and note taking go hand in hand. And the reason that happens is because you are very focused in this case, on my lecture, and any loss of, say, for example, concentration would mean that you will lose out the important bits which are being discussed in the lecture. And because you're listening in and tuned in to me directly in this particular lecture, this process would be active listening. Now, when we look at listening as a process, I don't know how many of you know, but if I talk about listening as a process, so if I write down the initials, of listening as a process, listening can also be sometimes, described by what is called a listen method. And this listen method, L stands for lead, I stands for ideas, S stands for signals, T stands for taking your time, because you take your time to write things. E tends to be effective, and then N tends to be notes. So this particular method that we talk about when we are actively listening and making notes is also sometimes referred to as what is called the listen method. And this helps you understand, certain things which are being discussed in a better way, in a structured way. And then what the notes that you're making is allowing you to do is basically making or remembering structured parts of the conversation which is being done in a way which will help you focus and also remember the important bits which have been discussed during the course of that particular session. Now, there is also something called, passive listening. So when we talk about passive listening as a process, passive listening as a process tends to be when you're listening without reacting. So sometimes it could be that you're allowing somebody is speaking, you're allowing them to speak, and you don't interrupt. And this would mean that you're at this moment looking at passive listening, wherein you're not reacting to the information which is being provided. And in those cases, when we look at the process of listening and taking in information, then you would probably look at calling that, you'll call that process passive listening. Now, an example of passive listening would be when you're sitting in a meeting or at a place of your work and you're listening to somebody who's talking. So in this case, if I'm delivering a lecture and you're listening to the lecture attentively without, say, providing me any feedback, this would be a process which is called passive listening. So you're not maybe really paying attention, but you're thinking of a list of things that you're doing, and that is where you're not providing me any feedback. And I would say this process is tending to be more of what is called passive listening. Now, on the other hand, when I look at active listening, what I would primarily say is in the same lecture, when you're looking at, when I'm discussing this particular topic, and if there is something that you don't understand, what you would do is basically unmute your microphone. And what you would do essentially would be ask me a counter question or ask me, could you explain that with an example? And that would be a process in which you're actively participating in the discussion. And this process would mean that you're fully concentrating, you're understanding, and you're also responding by asking me a question or giving me some feedback. And this process would then transform from passive listening to what is called active listening. Now, active listening, if we are going to also be in a same room, and if you're sitting across to me in the same room, and in some cases when I'm talking and I'm giving a lecture and you nod your head, or you basically, say, do some body gestures, that would also emphasize that you're actively listening. Because in this case, if you were face to face and I switch on my video and then I see that a few of you are nodding your head and are agreeing to me in terms of what I'm saying, that process would be that you're giving me feedback, although not verbally, but giving me feedback through body language, and that would also be included or classed as what is called active listening. Now, when we understand what is active listening and what is passive listening, active listening generally is done because it helps build confidence, trust, and it helps you understand people's situation. So when you look at a situation wherein you are going to a GP, and when you are in front of a GP and assuming you've gone to the doctor and you are not feeling well, you wait for your turn and then you get called and you go and sit in front of the doctor, and doctor will ask you a question that, okay, how are you feeling today? What brings you in today? And then you start explaining that, okay, I've been running fever for the last 2-3 days. I've started to have a bit of body ache, and I've had a bit of cold and cough. And the doctor will ask you counter questions to say, okay, what do you think? How do you think when it started? Or have you taken any medication? What are you eating? Or was it that you visited outside? So what he's doing is he's trying to come to a situation wherein the situation is going to be focused on understanding the underlying reasons of why you are running fever. And at some stage, the doctor would come out with some sort of prognosis. And it could be that sometimes they say, okay, because the weather is changing and, people are vulnerable and you can get flu, or you can, essentially get the virus. So in this case, the doctor would recommend you a prescription. And what the doctor would say is, you need to take care, you need to dress up and wear warm clothes, make sure that you're when you're going out, you have a layer or 2 layers of clothes on, because the weather is changing, and that could be that you've caught cold and that has led to fever. So here, the process through which the doctor is asking you questions and you're responding to those questions is a process which is basically involving what is called active listening and active listening skills. You're asking questions as a GP, as a doctor, and then the patient is replying to those questions to the best of their ability, and the doctor then reaches some sort of a prognosis. Now, sometimes we see a situation when you go to the GP and you go with you have an old, you have your older or elder, relative or your mother along with you, and she's not very good in communication. So what she would do is she would look at you. If you've gone with that, a GP asks a question or a doctor asks a question. If she doesn't understand, she'll look at you and she'll say, okay, what is he asking? And then you translate that in your language, and then you communicate that from what your mother has said to the doctor. Then in that case, the lady who's gone along with it would be doing the active listening, and the patient would be passively listening to what the doctor is saying, because she might not have an understanding in terms of the language, or she might have a difficulty in understanding the language, and that requires a bit of translation or interpreting to be done in the middle. And in those cases, that process would become passive listening. But sometimes you would still see the patient nodding their head. Yes, doctor, I understand. And there is a minimal conversation which tends to happen. And this would also be, emphasizing that, okay, that process is, so you are able to differentiate between that process. And that process tends to be, the process of listening. Now, we see this in healthcare very, very closely. And the reason why this is considered as a very important skill is because sometimes when you work as a healthcare worker, you work as a healthcare assistant, a professional, a nurse, a doctor or a GP or a practice manager, whatever profession that you take up in the healthcare sector, you have to have this particular skill of, listening, whether it's active listening or passive listening. Sometimes you need to just listen to the patient because they are overburdened with their emotions, and obviously they need somebody to talk to. And in this case, you provide that conduit wherein you become a person who's going to just listen into the patient and let the patient overcome his emotions. And obviously, you'll comfort the patient by giving very restrictive feedback, but you're predominantly in the mode of listening, and the person in the other side of the patient is in the mode of speaking. So that tends to be one of the qualities which is required in people who work within this sector. Now, active listening happens more or less every day on a daily basis in most situations. You go to a GP, you go to an emergency, you go to the A&E department, and there are things wherein you need to seek information, give information. And in those cases, that process would be providing proper feedback. You're having conversations, the questions being asked, you're responding to those questions. And in some cases, you're making notes and the doctor is making notes. Okay, what time did the accident happen? What was done? Who responded? What any medication which has been given? How long have you been having the condition? And the doctor is continuously making notes. And that later on comes across in the patient information record. And that would also allow the doctor or the GP to essentially then prescribe a relevant medication to get you rid of that condition. And that process tends to be the process of what is called active listening. Now, active listening or passive listening both involve you taking notes, because as a nurse, as a healthcare assistant, as a worker, as a person working within the healthcare sector, you're always required to make note of important points which are being discussed, or important pieces of information which is coming out of the conversations that you're having with your patients. So in those cases, what you would do is you need to be aware of what are the techniques through which effective notes can be made, and they can be then utilized or transferred. The information that you've taken, you've jotted down on the basis of making those notes, then can later be transferred onto relevant documents like the patient information record, like the prescription, like some sort of a medical report or a history in terms of medical history of the patient. And at some stage, you're filling up some forms either on the PC or printed forms, and the information that you've taken or gathered through the process of active and passive listening by making your notes is transferred onto a system which then can be archived, can be used in the future, and can be related to the patient and patient's medical record. And that is why note taking as a process becomes very, very important. Any questions on this so far? Any questions, anybody? So all well understood that why we look at this basic concept of note taking in particular, and what is active listening and passive listening. So if you have no questions, no problem, but at a later stage, if you do feel that you have any questions, feel free to ask me. Okay, that's great, Harrison. Thank you for that feedback. Now, when we look at the process of note taking, because this is a skill, so there are different methods through which notes can be taken when you're having conversations, whether it's active conversations or passive conversations. Now, there are 5 or 6 different methods, but there are 3 methods which have pretty much become globally accepted, and they are methods that we use, that we have learned over the years as a student, as a child going through the schooling, and when you've had other opportunities or either at the place of work, and we knowingly or unknowingly you would know and use these methods of making your own notes. And these 3 methods tend to be the outline method, the mind mapping method, and the Cornell system of note taking. Now, let's look at the first method, which is outline. Now, outline method of note taking is where the information that you're noting down tends to be beginning with a journal aspect. There are journal bits and pieces of information that you start to make notes on the left-hand side. And then when you start adding bits and pieces into that information, you start adding them by either adding bullet points or indenting them underneath the main topic. And that is where this process helps you understand that at a later stage, when you need to refer to it, it'll help you understand that, okay, this was the main topic of discussion. Like in today's lecture, the main topic of discussion is, be able to take effective notes from a variety of sources. So underneath that, if you have to look at what were the key bits discussed, you might write down, we've discussed active and passive listening. That could be first bullet point. Then you could write down 3 methods of note taking that we've discussed. But all that is under one overarching umbrella of the learning outcome 3. And that is where the outline method comes into play. So the outline method of note taking tends to be a method wherein you're looking at perhaps making or jotting down the most common types of. So if I put it this way, the outline method is the most common method of note taking. Now, when and where it is used in a situation is when you're predominantly in a lecture, you're a student, you are passively listening, and you're basically gathering a lot of information. And what you're doing is you're gathering that information, and you're or in a very structured and orderly way, filling in that piece of information, or let's say jotting down that piece of information under the main topics of discussion. And here you're organizing it in a way wherein it follows or flows through in a logical manner. So essentially, an outline method example, if I have to give you, would be a table of contents that you look at in the book. Now, it is a method which basically looks at putting down bits and pieces as a summary. So when you look at a novel, when you pick up a book, or when you pick up say, for example, let's say an article or a journal, and you want to look at the basic remit of what it is going to be talking about, you look at and flip through 1 or 2 pages. In the initial pages of the book, you would look at what is called the table of content. So it'll talk about chapters, section 1, section 2, then it'll go into chapter 2, chapter 3. So this method, which basically summarizes the pieces of information that you have written down in a structured way, but does it in a manner wherein it is structured, it flows in a logical manner, and forms or reads like a skeleton structure, would be the outline method, essentially, in terms of making notes. So here, when we look at an example of a textbook or a book or a chapter in a particular textbook, a lecture that I'm doing currently right now, which is all about discussing why is note-taking important, how is it done, what are the methods. It's all under the overarching umbrella of note-taking, and this would be what is called the outline method. Now, the other system that we also look at, which is a system which is developed by Cornell, and this system, which was predominantly developed by Cornell, is a method of note-taking which basically allows you to write the important pieces of information in some sort of short notes. So if I look at this example of, say, for example, if you were talking about a nervous system, so what we would do is we would write down the keywords on the left that, okay, in the nervous system, we are going to be discussing, things like, if I put it this way, nervous system tissues, we would discuss about, the various structures and how this, helps control the movements, the thoughts, what are neurons. And we'll talk about various, elements of the nervous system. Now, what you're going to do is when you use the Cornell method of note-taking, you're going to be looking at making short notes about each of the important terms which are being discussed in the concept of nervous system, if we are to pick up a topic. Now, in that topic, what you are going to do is, if I show this to you visually, what you're looking at is you write down the keywords on the left, you draw a line, and then you start writing a bit more to explain that particular keyword on the right-hand side. So it's like writing abbreviations or keywords on the left, and then writing some bullet points or, in short, description of what is the keyword or what is that you are essentially jotting down on the right-hand side, and that would tend to be the Cornell method of note-taking. Now, there are lots of steps in terms of this particular method, and anybody in terms of why is it called Cornell method of note-taking? Any thoughts on this, just as a curiosity question? So the reason why it is called the Cornell method is because this was something which was developed by Professor Walter Cornell, basically a professor who worked for the Cornell University. And in the 1950s, when a lot of people started working on this, and they came out with this particular method, and the details in terms of why this is going to be particularly important for students when they are studying, or when you are essentially in the university and obviously studying and taking lecture notes, then this method, which came about, was then referred to as the Cornell note-taking method. So it was a system which was developed by the university or the professor and his team, and this system of taking, organizing, and reviewing the notes as devised by Professor Walter Pork at the Cornell University is then named after him as the Cornell method of note-taking. Now, This particular method, also looks at, there are some advantages, and when you look at the actual working of this particular method, there are lots of different styles through which it can be done. But the general base being that you look at taking notes by identifying keywords. Those keywords are written on the left, and then those keywords are essentially then elaborated by writing short notes on the right hand side as bullet points. And when you try and go and review this particular topic or a section or a lecture that you've attended, and that helps you review the topic or the discussions which have happened during the lecture through this method in a very easy, structured, organized way, is what the Cornell method is all about. So it's about taking notes, it's about organizing them in a way wherein if you had to give these notes across to somebody else, they would also be able to clearly read and understand what material they are reading and how it is organized, and then how it can be reviewed to recollect what the discussions were or what the point of discussion was during that lecture. So it tends to be a structured and a very organized method, because on the left-hand side, you write the keywords, and on the right-hand side, you take short notes to explain those keywords, and then it follows a logical manner in which you can actually review your notes, whether you do it or somebody else does it. It becomes easier using this particular method. Now, the third method that I want to quickly talk about is what is called the mind mapping method of note taking. And this method of note taking, as the name itself implies, this particular method of note taking uses what is called the diagrams. Essentially, you're going to use flow charts and diagrams, or the idea would be to try and record information in a logical flow, wherein it allows you to talk and create a description which will help you at a later stage to understand the topic and recall the topic much more easily. So this method of note taking, when I say mind mapping, also sometimes is referred to as what is called the spider diagrams. And the reason why this spider diagrams, it is also called the spider diagrams, is if I bring a picture down into this particular slide, you would generally see that the main topic is broken down into further subtopics, and these subtopics are logically arranged, and they are connected using arrows or flowcharts or basically lines. And this particular method helps you organize the information in a logical manner to show the flow of where you've started the discussion on the main topic, and then graphically representing and connecting the various topics to subtopics, information, ideas, facts, and concept allows you to recall what was discussed. And this particular method is then called the mind mapping method. Now, this method also allows you to make connections, and it also allows you to provide an overview of what has been discussed using what are called diagrams, or essentially spider diagrams visually. And sometimes when we look at, I don't know how many of you have heard what is VARC. Have you heard about something called VARC? Anybody have they heard about or come across this term which is called VARC? Now, VARC is an acronym. Sometimes as teachers, when we look at teaching, we look at bringing VARC model of learning styles. So this is a model of learning styles which basically classifies learners or people, how they learn, into 4 different types. So VARC stands for, V stands for visual, A stands for auditory, R stands for reading or writing, and K stands for kinesthetic. Now, this particular method of learning actually, came about in the 1970s. And what a lot of teachers started to do was they started to look at essentially, doing a test or asking learners to essentially do or take a multiple choice question, test, which was used to then identify the learning style of the learner. So this was introduced by Professor Neil Fleming, and it's a style which currently, is a methodology now which is currently used predominantly in any sort of a teaching setup. And what we do is, first of all, we look at asking the learner or as a student to fill up a VARC style question. And this questionnaire, VARC questionnaire, essentially helps us in picking out what is the learning style that you have as a learner and what is going to be the most optimum way through which you learn and you understand things. So sometimes you would see learners, if I am shown an image, I can remember that image or remember the things which are on that image or a diagram visually. So I can learn, I'm fast as a visual learner. Sometimes you look at hearing a lot of things and you're able to learn quite well and effectively. And in this case, it tends to be auditory. Reading and writing are sentences for reading and writing. So sometimes learners understand if they read things themselves, write or reproduce that would help them, understand things better. And then in the kinesthetic type, we are looking at movements of arms, body language, experimentation, hands-on activities will be done. And that sometimes is the preferred route of learning for some learners. So when we look at note-taking, and what I was trying to do is relate it to these of note-taking. So when we talk about mind map method, here is where we talk about, spider diagrams. And in the spider diagrams, sometimes we have to explain things in a way which allows learners, some learners to understand things visually, understand things, through the auditory route. And in those cases, what we tend to do is basically look at using the VARC style, learning style questionnaire to understand what could be the most effective way through which a learner can actually remember things. And that in tandem, when used with, the mind mapping method, tends to work better for some, learners. So here, what you would see is essentially the topics and the subtopics are connected graphically or with the use of, flow charting techniques. And it then helps build what is called a logical flow of information when you are looking at doing. So if I give you a simple example now, assuming you're required to undergo operation because you have a particular condition. So what will happen is you would have started this discussion with your GP or your surgery. The GP or the surgery would have recommended you for a certain test. You would have got these tests done at the hospital. The results of the test would have come out, and the results would have been either positive or negative. If they have been negative and they cannot be looked at being treated by medication, then in those cases, the doctor would then refer you to a consultant. A consultant would then have its team, the clinical nurse, the psychiatric, staff will go through with you in terms of understanding what would be the procedure, what will be involved, what are the risks, what are the benefits. They will take you through a full process. And at some stage, they will ask you to consent. If you consent with the process, then a date would be looked at, and that date would then be looked at a date for surgery or operation. And then the doctors would be intimated, and the doctors and the surgeons would then look at operating on you. And then later on, after the operation has been done, you'll be looking at getting, treatment post your surgery. And then at some stage, you'll get better soon. Now, if I have to describe this process, one way of describing is I might do a flow chart. I might describe it as bullet points. But the most effective way, if somebody has to visually look at it and say that has this checklist been done or has this been done, has this been done, what will happen in those cases would be you would be looking at maybe using a mind mapping method to go through that all these steps have been done before even this patient is undertaking surgery. And this could be a way to summarize pieces and pieces or pages and pages of information into one small page, which would use diagram, graphical representation, flow charting, or a visual way through which you'll be using to depict the summary of the steps the patient has undergone. And that would be the process that you would use to summarize using what is a method called mind mapping. Now, any questions on this stage? Three methods that we discussed, three different situations where these methods could be used. And that is where it is important to understand that when you work within the health and social care sector, you should have the ability to be able to actively listen, passively listen, And when you're in the listening mode, you also have to note down important pieces of information. And that noting down of information can be done using 3 different methods: cornell method, mind mapping method, the outline method. Any questions on this so far? Okay, now let's go to understanding. Obviously, when we understand these methods, there are bits and pieces that we also need to understand and remember. That note taking can be effective if we keep the 5 R's in mind. And these tend to be that you need to record information in a logical and in a legible manner. That means you need to make notes at the right time and also make sure that they are legible, that somebody reading those notes could understand them in terms of what has been written down as pieces of information. Reduce, that means you don't need to replicate or capture everything as it is. You're looking at capturing what are called meaningful points, important points, and then organizing them in a way wherein this gives you the essence of the information, or the summary, or the gist as we call it, but you're not replicating or reproducing everything which has been discussed, which might not be of importance at a later stage. So what you need to do is understand the process through which you take down only important points, ideas, information, facts, and those are then noted down as notes. Then you look at reciting, reflecting, and reviewing. So reciting would mean that you're choosing words carefully to ensure that they have the same meaning when we look at remembering or recalling that information. Reflecting would mean that in some cases, when you have your own ideas and thoughts and you go through and read the notes, you're making sure that they are recording, you are recording the ideas and the discussion which has happened in the original format. That means you're not deviating from or inferring to something different than what has been discussed. And in those cases, sometimes when we look at the process of reflection, by taking feedback, by doing a review, that is normally done by doing, what are called discussions. And these discussions tend to be, looking at the process through which you do a bit of reflection, that what went well, what was not, done correctly, and in some cases, what could have been done in order to capture that information in a way wherein it becomes a serious thought for consideration. And in those cases, you would look at what is called the process of reflection. Now, last but not the least, because you're taking notes, you're recording information, one of the reasons why you're also taking notes is that you want to make a record. That means you want to record important points which could be used in the future, or which could be referred to in the as and when it is required in the future, to basically look at diagnosis, giving out prescription, looking at the condition. And in those cases, you also look at the process of review. So essentially, when you look at the process of reflection, you're taking down things in a way wherein you're using and noting down things which describe what you were feeling at that point in time, especially in the health and social care sector. You would be looking at evaluating those feelings by doing a bit of reflection. You'll do some analysis, and at some stage, if you felt that this did not go as per process or as per the process which has been described to me, then you would look at maybe taking a corrective action, and that corrective action would happen because you're doing a reflection and you're following the process of review. And if you think the things have not gone well, then in those cases, a reflection and a review becomes all the more important, because you're going to be looking at correcting things or making corrections to the steps wherein this did not go as planned. And in those cases, these 5 R's have to be remembered essentially during the process of what is called note taking. Now, having discussed this, topic and the learning outcome in terms of the details which are required to be understood when we talk about note taking and note taking technique and the variety of sources through which you can do that, let's quickly address the the assessment criteria 3.1, which is the only assessment criteria in this learning outcome. And the assessment criteria talks about which talks about note key points of information from variety of sources using active listening and reading strategies. So here what I would want to do is basically play a quick video. And what I want to do is show that video to you so that we understand why it is important and how do we go about, doing this process. So let me just pause recording and I'll play a YouTube video, which I'll share with you on the screen. Just give me 1 second. So we are going to be looking at this particular video of what is active listening and what does this mean when we talk about the process.
The day that we signed up for Monday.com, our department was already able to connect our processes, our software.
So let's listen into this short video.
Information you get every day from listening. Your boss, your colleagues, your clients, and your suppliers may communicate with you often. So will your family and friends. How much of what all these people say do you pay attention to? How much are you actually remembering from these conversations? Chances are it's a lot less than you think. A lot of times we act as if we're listening to the other person, but the reality is that our minds are racing to other topics or already planning what we're going to say in return. This means that we can miss important things that the other person is saying. Active listening is when you make a conscious effort to hear and understand people so that you get the complete message. There are several things you can do to become an active listener. First, you need to pay attention. We know this is a bit obvious. It's the most important part of active listening. For instance, make eye contact with the person talking to you. Ignore outside factors like other conversations so that you can focus solely on what the person is saying. Most importantly, put your own thought on hold. Resist the urge to start planning out what you're going to say in return. You also need to show the other person that you're listening to them. You can nod your head, smile, and say yes occasionally. All of these signals let the other person know you're still with them. Providing feedback on what the other person has just said is another important part of active listening. For instance, all of us hear information through our own personal filters and judgments. This can affect our understanding. To make sure you heard and understood the message correctly, paraphrase it or repeat it back to the person. You can also ask questions to get more information, but make sure that you listen to what they're saying before you plan your response. You also need to avoid interrupting when they are speaking. Once they're finished, you can respond appropriately and with an honest answer or opinion. Active listening is a skill that all of us should use more often. The better you are at listening, the more information you'll receive. This can pay off with big rewards in your career and strengthen your bonds with family and friends. You can find out.
So as you can see, what we discussed in the process of active listening is more or less, in terms of being repeated in this particular video. So that is one of the reasons why we need to be focused on developing this as a skill, specifically for people who are working within, not just in health and social care sector, but yes, to a certain extent, in certain sectors, it is more important and more required because you are going to be looking at having more conversations and obviously looking at, making more notes. Now, this process, when we look at, and what we want to do in this assessment criteria is how we want to understand how do we gather information from a variety of sources. So one of the sources through which you can gather information tends to be the process through which you actively listen and engage in conversations. Now, when we look at this as a process, as I mentioned earlier, you're looking at paying attention, you're focused, you're listening, you're providing body or feedback verbally oblique through your body language. And what you're doing is you're not letting your thoughts prejudge what is being discussed, but you're basically just focus on understanding and listening in terms of gathering as much information as possible. Once the other person has stopped and has spoken and you've written down bits and pieces of information, then you respond appropriately. And in those cases, you're able to capture all the important bits of the conversation, using this particular method. Now, when we look at the process of active listening, there are also 3 A's which are very important in terms of what is your attitude, how much attention you're paying, and what is the adjustment that you're doing when you look at the process of active listening. So when we talk about the 3 E's in particular of active listening, what we are essentially focusing on in that case is sometimes you get into a conversation and what you see is that the other person is giving you a bit of an attitude. That means they are although present, but they are not responding or not willingly responding to what is being discussed. So in this case, the fundamental difference tends to be that whether you're listening or you're hearing. So if you're being a passive listener, that means you're just listening into the conversation or tuning into the conversation without providing any feedback or paying attention, then you are essentially just hearing that information and not paying attention to what is being discussed or spoken about. So that could be a subtle difference between what is called hearing and what is called listening. Now, when you're paying attention and your intentional efforts are that you're paying attention and you're responding and you're essentially ensuring that you're able to give feedback as well, then in those cases, the conversations tend to be more meaningful because the person senses that the person in which, or the person with which they are having the conversation, they sense that yes, the person is paying attention or giving them due attention. And that is where the conversations become more meaningful. Now, if I get into a long business meeting, or assuming you're having a meeting and that meeting runs into lots of different issues and discusses a lot of different points. So in those cases, what will happen is either you lose interest, or in some cases, you would primarily become a passive listener. That means you're just hearing because you're saying, okay, this is not related to me. This is not something which, I need to pay attention at. And in those cases, you're hearing the conversation. So your attitude and your attention towards the discussion which is happening in the room decreases. So in those cases, the signals which the speaker gets or the person who's sitting opposite you gets is that, okay, let's stop this conversation. This is not going to lead to any, outcome because the other person isn't very interested. So attitude is sometimes important, as important as sometimes when you're in the conversation physically and mentally present. But the attitude is also important is because you are, it is basically showing to a certain extent, what is the internal motivation you have in listening to that particular person or having that conversation with that person. And in those cases, you would look at, the importance of attitude as well. That means you're coming with an open mind. Sometimes you say, let's have an open mind in terms of this conversation. What you're trying to basically emphasize is that let's discuss this with no preconditions, and that would show your attitude, whether you agree or disagree. But the idea thereabouts is to make sure that you are essentially, looking at having an open mind to having this conversation with the other person. That means you're going to patiently listen and react in certain situations, but put together those points in terms of your reaction as constructively as possible, which would show that you're genuinely interested in having that conversation. And the third part tends to be adjustment. Now, adjustment tends to be, sometimes we do a simple adjustment in terms of tuning in the volume on the TV. If you're listening to somebody, if there's a phone call which comes in the background and you increase your volume on the TV, what you're doing is you're adjusting to what you're actually listening or you're watching and listening on the TV. So adjustment would really mean that you are adjusting to what the listener is saying and you're willing to change, adapt, and obviously, follow the speaker, or basically in that conversation, follow the person until and unless you have, or you both of you decide to have or come to some sort of a conclusion. So in this case, if you're willing to, if you are showing that you're making the adjustments to listen to the person carefully, attentively, that would basically mean that you're adjusting to ensuring that, yes, you are interested in having this conversation with the learner. So conversations sometimes you would also see require every person to have a presence of mind and also a bit of focus in terms of what they are discussing and what is required to be discussed. So in those cases, when you look at making the adjustments to focus and demonstrate that you are interested in having this conversation with the person, shows that you are willing to participate and you're willing to pay attention and shows your positive attitude towards the person that you're speaking to. And this would be, if you say, for example, a simple example that I will give you is if you're wanting to get into a meeting, you get in, you sit around the table, you adjust your chair, you basically, listen or tune or turn towards the side of the person which the person is going to be speaking, standing, or where the person is speaking from. And this would show an adjustment that you're doing. You've sat down on a chair, you've tilted your chair slightly to look at the person eye to eye, and your body is also slightly turned in to address that person or listen into that person, and that would show the process of adjustment. So typically, sometimes when you sit in a meeting and you, rather than sit back on your chair, you sit in, you sit attentively, and that will also show adjustment. So the 3 A's are very important, which is attitude, attention, and adjustment when we are looking at the process of, listening. Now, what are the variety of methods? The last bit that we want to look at is focusing on what are the variety of methods through which you gather information. Now, these are the 4 methods through which you gather information, specifically also classed as reading techniques. Now, these tend to be skimming, scanning, they tend to be intensive, oblique, extensive. And, basically, sometimes what you will do is when you skim, anybody who's aware of the process of skimming, what is skimming? What does it mean? So if you say in the morning, anybody, sorry, go on. What is the process of skimming?
Skimming is when you just look through an information, it's not written, you just glance through, like looking at the heading of a newspaper. You just like glance through and see through it. If I'm
absolutely correct. So you are interested in reading about the information, but what you're doing is you're skimming through by visually going through the bits of information, and you're trying to, look at picking out important points. So it's an action of reading, which is sometimes done quickly, but you're only focused on picking up some of the important points. So if you look at the example that you've given, which is a very good example of newspaper, sometimes when you see the newspaper, you pick up a newspaper in the morning while, coming to the office, sitting in a tram, and you're taking a bus. What you do is you pick up the newspaper from the newspaper stand, and what you go through is headlines. You go through some of the bullet points, you go through some of the big headed headlines, which are given in big fonts or bold fonts, and they would tend to be, the process of skimming. So if I look at the, today's newspaper headlines, if I just briefly look at sharing my screen again. So if I show you, say, some of the papers today that we are looking at, on the website. Now, if you see, if I open one particular paper, for example, that I want to look at, what I would do is I would quickly look at what are the headlines for today. So, if I look at this particular paper, or if I click on one other paper, for example, and I click on this, what I would want to do is there's lots of things, going on this page. So what I would do is quickly understand what are the main news items today. So City, defeated Man City won 6-3 against Man United. That's a headline which I've skimmed through. Now, just looking, the Prime Minister looking at delaying the 45p, the tax, and there could be a U-turn on it. That's the other thing. I'm going through these details. And then I also read hospitals are scrapping more than 22,000 appointments every day. And then I'm looking at just visually going through some of the important bits, which are main headlines, and trying to understand what information is being provided. And this would be, the process through which I would go. And I would say this is the process of what is called skimming, right? So you're going through important pieces of information. Sometimes you're reading some of these things quickly, and the reading some of these things quickly is tending to be the process of what is called skimming. Now, what is scanning? If I'm trying to find any sort of information, if I'm trying to look at a specific bit of information through the papers, specific headlines or anything specific that I'm trying to do, that would be an example of scanning. So scanning tends to be when you're trying to find some pieces of text very quickly or some specific details on a piece of document paper or anything that you're looking at. Sometimes we go into a new place, you go into a hospital, and what you do is you suddenly turn around, and what you do is you turn around and you see, okay, where the reception is, who do I reach out to and ask a question. So what you're doing is you're turning in and around, and what you're trying to do in that case is basically do the process of scanning and video in my case. And what I would do is if I get into a hospital, and what I would do in this case is, okay, I'll quickly start looking left or right. Where do I get hold of somebody? I need some help, or I need to look at the reception, and where do I go and get a stretcher or wheelchair, or for somebody that is out in the taxi, maybe your elderly mom or father, whatever. And then what you're doing is you're basically scanning. You're scanning for an important piece of information or looking for a specific detail. And in those cases, you would be scanning. Now, another example I would give you essentially would be that if I were to look at, assuming if I were to look at a telephone directory, and I was looking at finding somebody's number in specific, that process of going through alphabetically by turning and say, okay, I'm looking at A, I want to find Dr. Liz Truss. So what I will do is go to L, and when I'm at the L page, and I'll look at L, I, and then go to Z. So what you're doing is you're searching for a particular address or a particular number or a particular name, and what you're doing is you're scanning for the page, essentially for a specific person, and this would essentially mean that you're looking at scanning. Now, how do we differentiate between the process of scanning and skimming? So when we look at the process of skimming, it is a process through which you're reading an overall view or trying to get an overall impression of the content. And that tends to be when you're picking up the main bits. In this case, the newspaper, for example, government shaps attacked tin and Tory tax cuts. So what you're doing is you're trying to make a sense of, okay, I've read this headline, and is it that they're trying to, then you read maybe the second bold, headline, which says 14 rebels oppose and ask for the chancellor to ditch the 45p tax rate, which has been abolished. So there or say essentially, and then you look at, if you can't make sense of it, you read it further. Potang's survival touch and go claims Osborne. So here in this case, what you're trying to do is you're trying to get an impression of what the content of the write-up or the article would be. And what you're trying to do is pick up the main messages here to decipher that. And that would be the process of scanning. Now, if I were to look at scanning on the other hand requires you to look for a particular word or a phrase. So in this case, I might say, okay, has he really looked at abolishing? Is this a U-turn which the government is doing? So I've got some words which are coming to my mind in terms of abolishing the 45p rate of tax, or the government looking at, the chancellor in this case, doing a U-turn. So what I'm going to do is scan this word U-turn or abolish, and that would mean that the government is has done a U-turn and brought back the 45p tax. And that process would essentially be, so are given reports of patient, you are looking at lots of details of the patient in terms of patient information record, his medical history, or previous medical history. Then in those cases, what you're looking at doing is you're sometimes required to skim and scan and use these two processes to understand and gather the relevant information which is required for you to come to some sort of a conclusion. Now, scanning can be done intensively and extensively. So obviously, depending on what is the piece of information you need and how, you need that information, how detailed you need that information, you'll go through that process of, scanning it. Now, when you do scanning, you're intensively scanning. That means you're reading intensively to understand what is required. And in some cases, you'll be looking at, understanding, say, for example, when I say intensive reading in those cases would be that you're basically trying to get hold of the topic and the information in detail. So here you have specific aims and objectives, and you're trying to find that bit of information by doing scanning, but you're doing it in a way where you're looking for specific information, and you would go into detailing to look at some of this in a bit more detail, and that would be intensive. So in this case, when I say intensive reading, it will be looking at reading and testing, and also looking at maybe in some cases evaluating the information that you've received, and that would then be utilized or utilized later for the purposes of maybe diagnosis or prescription or things like that. Now, the purpose of intensive reading tends to be the focus is on the content, what you're trying to find, and are there any symptoms or symptomatic patterns that found. Say, for example, in the case of a patient record that you're reading, so you're reading one medical report, you're reading another medical record, and you have 3 medical reports. What you're trying to do is you're reading through the same bits, but you're trying to see if there is a pattern in those reports, and that is what is going to be intensive reading. Sometimes this reading could be done alone, and you could read the information aloud because you want to remember some pieces of information as well. Now, when I compare and contrast this to what is called extensive reading, then in this case, when I talk about extensive reading, what we are doing is we are doing this reading for our own pleasure. You're basically doing this reading for enjoyment. For example, if you read a novel, you read a book, and you want to gain more knowledge into a particular topic, and you do it at your own leisure time and at your own pace, then you're basically looking at doing what is called extensive reading. And this is where the process of reading tends to be longer in terms of time frame, but you're going to go through it over extended period of time. And in this case, what you're looking at doing is you're going to look at making it easier, enjoyable, and you will do this at your own pace. So examples of extensive reading tend to be when I'm reading a novel, I'm reading a journal, a newspaper. On the weekend, you pick up a newspaper that you bought today and you want to read it. There was an interesting few articles and you want to read them at your own pace. And what you do is you sit down on the weekend on a Saturday with a cuppa, and then you start reading them at your own leisurely pace. And that would be the process through which you would look at extensive reading. Now, I hope this particular bit has now covered, the topic of what and how do we collate information from a variety of sources using the process of active listening and passive listening. What are the techniques through which notes can be taken? And then why sometimes when we look at taking notes or reading information, we do the process of use the process of skimming and scanning, and then come out with the important bits of information. Now, this is a slide in which I want you to do a bit of a task. When you get to this presentation, what I would suggest is you pick up an article, which I've put up here just as an article which is primarily related. You might pick out an latest article from a newspaper or from a website, and also would ask you to pick out an article which could be from the within the sector, say health and social care sector. And what I would ask you to do in this case is read the article, but read the article through the process of skimming to understand what are the main points being discussed, and then read another article and read it through the process of scanning, wherein what you're trying to do is understand the important bits of information and also trying to make notes to say what was being discussed in that particular article. And this would help you, clarify and, clear the concept in terms of, the process of skinning and scanning. Is that okay? Any questions on this session that we've done today with regards to understanding how do we take notes, how do we gather information from a variety of sources, and obviously looking at understanding details in terms of the note-taking methods and the skimming and scanning strategies of reading. Any questions on this so far?
Yeah, hello.
Yes.
Yeah, when writing an article like what you just said, take it for instance, if someone picks a topic, is it going to copy the original text and write on its own, on our own, maybe differently, so that someone will be able to know what the article is, or just have to write without copy the original text first?
So this particular exercise that you're doing is going to be looking at, covering the assessment criteria 3.2 of this particular learning outcome. So it's a good question that you've asked, and the reason I didn't mention it, I wanted to see if others are also able to capture this. We've got 3.1 that we've understood. How do we collate information? Now, once we've collected the information, how do we present this information? And that is in assessment criteria 3.2, which talks about how to summarize the information which we have collected through the process of either note-taking, active listening, passive listening, or through the process of, the 4 processes: skimming, scanning, and in scanning, intensive and, extensive. So here, the approach primarily mentioned to you was to shortlist a article of interest. If I take you to the presentation, an article of interest, and let's say 1 or 2 different types of sources of information. So one could be an article and one could be a website. And then what you're looking at doing is taking a screenshot of it and then writing after reading it, using skimming and scanning, then writing it in your own words. And that would help you to understand that how do you read and gather information and then write it in your own words using paraphrasing as a technique to present what you've gone through, or to represent what and recollect what you've gone through in terms of reading. So a newspaper report or an article in particular would be helpful. And then what you need to do is write it in your own words. That would be explaining what you have read, what you have inferred from that particular article, but doing so in your own words. And that process is going to be, basically the process of summarizing the information. And when you do this in your own words, that would be called paraphrasing. You are not going to be altering the meaning of the text which you have read or the article that you've read. You're just merely writing that in your own words in terms of without altering the meaning of it. And that process is going to be called paraphrasing. Does that answer your question?
Partially anyway, but my real question was that, take it for instance, if I'm writing article to you or paraphrasing an article to you without you seeing the original text, how will you be able to identify if what I wrote is actually written by me or copied from somewhere? So that's why I was asking if the original text have to be copied, then why the paraphrasing have to be written separately? That was actually my question. Or if there's no need to write if there's no need to copy the original article, just always have to paraphrase.
So in this case, what you'll have to do is take a screenshot of the article.
Okay.
Not the full article, but as I said, pick up an article or a news of your interest, write it in your own words without changing it in any way to reflect the views of the author. So the article screenshot has to be put. Obviously, otherwise I won't be able to correlate what you've actually read and what you've actually reproduced. So a newspaper article or a website article, you have to do a screenshot of it.
Okay.
And write it in your own words using paraphrasing, and then include that as a document. So a screenshot has to be included so that we can refer to that this is what you read and this is what you have inferred and written it in your own words.
Okay.
Good stuff. Anybody, any other questions? Anybody? Any other questions for today's session? Okay. Ikra, any questions at your end?
No, thank you.
Okay, great. Sharman, any questions at your end? Rose, any questions?
Hello.
Hi.
Yeah, I have another question. At the beginning of this session, you were talking about SWOT analysis.
Yes.
You know, we've done it before. I don't know if this one you're requesting is going to be different from the earlier one we did before.
Where did you do this earlier? In which unit?
The first, is it, At the beginning of the head and social call, you told us you were talking about SWOT analysis, what our strength and what we are not able to do, and we at the time you asked us to submit it then. But I don't know if what we requested today is different from that initial one, or if someone has to do it on every section. That's what I don't understand.
No, so in this case, I don't think this is something which has been done before. This particular unit focuses on you having to do your SWOT analysis around your English proficiency skills, your referencing skills, and your academic writing skills. So the SWOT analysis is primarily going to be used for these three areas. And in order to broaden this, what I also added was IT skills and maybe your organizing skills. But generally, this one is specific to the 3 bits which have been asked to be done in the learning outcome 1, which is primarily on your language skills, which is reading, writing, speaking, listening, and reasoning. And the self-assessment is primarily focused on your academic competencies, which is, say, for example, academic writing and Harvard referencing. Okay, any other questions, anybody? Rose, any questions at your end?
No questions, sir.
Okay. Ghazala, any questions at your end? Susan, any questions at your end? Rimza, any questions? Mariam, Nafisa, Emmanuel, Sohail, Sayed, Saresh, and Shakfat. And then I have Harrison, you asked me a question. Okay, that's great. So Jefferson, thank you. Thank you everyone, in fact, for joining the session today. And we'll be meeting tomorrow at the same time to cover Learning Outcome 4. So up until then, this presentation will go on to Moodle just shortly after this session. And then I will see you guys tomorrow. Thanks for joining, and bye for now.
Thanks.
Thank you, everyone. Thank you, and bye for now.
Bye, sir. Bye.